In today's video, we will talk about cardiopulmonary resuscitation. It is often called CPR. We will also talk about medical orders for scope of treatment, or MOST. CPR is given when a person has a cardiac arrest. This is when your heart stops beating and your lungs stop breathing. A cardiac arrest is different from a heart attack. CPR can include someone doing any of these things. Press on your chest to pump blood through your heart to your body, push air into your lungs to get oxygen to your brain, give medications, or use an electric shock from a machine to try restarting your heart. Should your heart restart, you'll be put on life support machines. CPR will not improve any medical conditions that caused your heart to stop. CPR is a life-saving technique and is a treatment option like other medical procedures. CPR works best if others are there with you when your heart and lungs stop working and someone starts CPR right away. Study shows that if your heart stops for more than 5 minutes, there is a good chance you will die or have brain damage. Brain damage affects your ability to talk, recognize people who matter to you, and to take care of yourself. Of the adults who have CPR right away, only 2 to 3 out of 20 adults, or 10 to 15%, are likely to survive. Only 1 out of 20, or 5% of those who survive will recover well enough to return home. The chance of survival and recovery depends on a number of things. Typically, the younger or healthier you are, the higher chance you will survive the CPR intervention and with fewer problems afterwards. The older you are, or the more illnesses you have, the lower the chance you have of surviving and recovering well enough to return home and enjoy what matters most to you. CPR is a treatment that is offered or recommended to you by a doctor or nurse practitioner if they think it would benefit you. This is determined through a conversation with you about A, your current medical conditions, and B, your priorities, goals, and values for your life. Thinking about what matters most to you and sharing the information to your doctor or nurse practitioner can help them provide you with the best recommendations. If CPR is not recommended by your doctor or nurse practitioner and a do not attempt CPR is ordered, it means CPR would cause more harm than good, and therefore no measures will be taken to restart your heart and lungs. However, you'll still continue to get good medical care. A do not attempt CPR order does not mean the healthcare team will withhold life-preserving treatments such as dialysis, antibiotics, or blood transfusions, and it does not impact the care and treatment you will receive for your other conditions. Understanding the risks and benefits of CPR and how it might impact you and your health journey helps you make informed decisions about your care with your doctor or nurse practitioner. Having ongoing conversations with your doctor or nurse practitioner can help with understanding. Making a plan for your future health and having conversations are the best way to make sure the people who matters to you know what is most important to you and what your health goals are. We also want to talk about MOST, also known as medical orders for scope of treatment. This is a medical order completed by a doctor or nurse practitioner. It provides directions to your healthcare team and emergency responders about CPR and other medical interventions. Choosing a MOST category that is right for you is a shared process between you and your doctor or nurse practitioner. Together, you explore what is most important to you, your current health, and what your health might look like in the future, and the types of treatments that may or may not be helpful now and in the future. For some people, depending on where they are at in their health journey, being comfortable is most important. For others, they will want intervention for medical issues if treatment could make their health better. Some people have strong ideas about whether they want to go to the intensive care unit or not, whether they might want a tube that feeds them, or a tube that helps them breathe. It is important you understand these different kinds of interventions and share what your goals and life priorities would be in different situations with your doctor, nurse practitioner, and other healthcare team members, as well as those who matter to you. Understanding how receiving CPR would affect how you live afterwards is an important part of choosing to have CPR. Some key points we wanted to highlight. A do not attempt CPR order does not impact any other aspect of care that is given to you. You will continue to receive medical care that meets your current needs. The chance of survival and recovery depends on a number of things. CPR works well for people who are young or healthy. The older you are, or the more illnesses you have, the lower chance of surviving and recovering. MOST is a medical order. Based on your health, your doctor or nurse practitioner will recommend treatments that would benefit you based on your priorities, goals, and values for your life. We hope you found this video informative and the content valuable. If you have any questions and would like to learn more or discuss this topic with your doctor, nurse practitioner, or other healthcare team members, please contact them. They'll be able to support you through the shared decision process.